So I'm Jen Vanderhoven, Director of the National Horizon Centre. Thanks for joining us today for In Conversation with the NHC, where we talk to key leaders about current and future challenges and opportunities in the bioscience and healthcare sectors. Today I'm talking to Nathalie Carter, who's a Darlington-based Wellbeing and Stakeholder Relations Consultant, and also the Patient and Public Involvement Manager in the Innovation, Research and Life Sciences Group at NHS England. And she also recently worked on the Department of Health and Social Care COVID-19 testing programme as a Senior Engagement Lead. So welcome Nathalie, great to have you here today.
Thank you for having me, Jen.
Great, so do you want to start off by telling me a bit about yourself and your career to date, leading on to your current roles and the work you do in the healthcare sector?
Absolutely. So first of all, it's fantastic to be interviewed by the NHC based in Darlington. I am a Northern girl originally, so I am originally from Richmond in North Yorkshire, just down the road, and I've lived in Darlington for the past 10 years. So after I did my A-levels in school, and one of my AS levels was in biology, I went off to London and I studied politics at Royal Holloway. And I realised I had a real interest in policy, but also in healthcare. So I then did a Masters of Science in Health, Community and Development at the London School of Economics. And we studied disease management, how to manage outbreaks of complex situations such as tuberculosis in war zones, for example. I did my dissertation on the psychosocial impact of HIV diagnosis in pregnancy, which was actually used by the APPG in Parliament at the time for some evidence on social care discussions. I then studied postgraduate diplomas and certificates in epidemiology at the London School of Hygiene and Tropical Medicine and Newcastle. And after study, I should probably also mention I did a 1-year international relations exchange to Australia as well. So I really got to learn about politics and healthcare from, I would say, a very global perspective. So after university, I started doing some work with the UN as a United Nations Association youth coordinator. And I was working out in the Netherlands and in Spain. I also went off to conferences in Canada and Albania, and I was coordinating the Youth Committee on HIV and AIDS, and also the Youth Committee on Gender Equality. And in terms of the HIV Committee, I would say that was my first experience in kind of the policy level of healthcare, because we would write the youth position statements and then send them off to the UN special sessions. I then actually started my first job working for a HIV charity down in Brixton called Positive Parenting in Children, and I absolutely loved it. I got a real insight into how health conditions had an impact on the daily lives of patients. And I was a fundraiser and a children's worker there. I then got headhunted at quite a young age by the NHS, and I was asked to coordinate the National Chlamydia Screening Programme in Greenwich, Bromley and Bexley. So there I was in my early 20s coordinating this chlamydia screening programme. And then my boss at the time, who was the head of sexual health, said, right, let's turn this into a full sexual health screening office, and, you know, do some piloting and research for home HIV testing, which had never been done before. So I think my healthcare roles have always really been at the innovation side of healthcare. So I then moved back up north a couple of years later and did I did some work actually for Mind, the mental health charity. I was a team leader there in Teesside, and then I was offered a job as a public health practitioner, directly working for the NHS again across Durham and Darlington. And for 5 years, I worked across a whole range of public health. So everything from 0 to 19 children's public health, to commissioning teenage pregnancy and sexual health services, health checks, cardiovascular disease, substance misuse. And then I did a bit of consulting, which took me out to amazing places such as Ireland and Boston in the US, and a lot of mentoring in schools on wellbeing. And then I joined NHS England a few years ago. I spent 2 years as a public health programme and contracts manager for Cumbria and the North East, managing flu immunisation programmes. So I managed the school-based IMS and I managed the maternity immunisation programmes. And then I joined the National Innovation Research and Life Sciences Group, initially as a research and innovation manager, and then as a patient and public involvement manager, which is what I currently do now. And then within that, I was asked to go on a secondment to the Government Department of Health and Social Care, and I spent 5 months as a stakeholder engagement lead on one of the central COVID-19 testing programmes.
Wow. Wow, that's amazing. That's quite some career to date. So you really are the perfect person to be talking to about what the current challenges that the UK kind of faces in healthcare innovation, in particular the NHS, and how the UK can recover from COVID. So do you want to tell me a little bit about what you think the current sort of challenges are?
So we're obviously in a recovery phase. So much of the health service attention, and obviously I will only say what's in the public domain, but much of the health service attention has understandably since last February, March been focused on COVID. And so I think one of the key challenges now is obviously continuing to meet the needs of COVID, in terms of the programme management and the population health aspects, and the reduced transmission, which is already I would say well under control, and and has been for a long time. But I think the key thing now really is restarting many of those health services where we did see reduced activity during COVID. So one of those areas is in research. So during the pandemic, non-COVID research and COVID research had periods where they really dipped, where they really reduced. And so a key priority actually for the NHS now is to continue recruiting people to research and to clinical trials across all areas of healthcare. But it's really, really important as well that all the other areas of healthcare, whether it's cancer, whether it's respiratory disease, and there's some of the things I work on in my current role, that all the activity in terms of the treatment, in terms of all the standardized appointments, not just the research, it's really important that all those services continue and get back up to speed.
Yeah. And where do you see the opportunities for collaborating to make sure that the services and the research start again? What can we do, particularly in the North East, to try and help that ecosystem?
So I think there are huge opportunities for collaboration. So within my current role, for example, we work with many partners. We work with NIHR, that's the National Institute of Healthcare Research, and they are one of the leading funders as well of healthcare research. We work with NICE, and we work with MHRA, the regulators. So I would say at a national level, there is a significant amount of partnership working that happens. And it would be amazing to see some of that collaboration at a really senior level in terms of, the key decisions that are being made, the funding. It would be amazing to see an acceleration of that in the North and in Teesside, because and in Darlington, obviously, and I know obviously that at the moment there's a lot of rapid growth happening in life sciences, in the bioscience sector within this region. And so I think we need to just continue engaging with the national funders, the national policymakers, and make sure that all the opportunities that are available are really, really well promoted in the North, so that both the NHS up here and all the healthcare and life sciences companies are fully aware of all the opportunities that are available, to really stimulate both both the research activity, but also the continued economic growth and the improvement of healthcare.
Excellent. So what would you say to someone who was thinking about, how do I start a career in the NHS or in biosciences? How would you kind of promote, particularly the North East, but the UK as a whole is a great place to start a career in this kind of area?
It is. So I think one really important thing is to have good guest speakers going into schools and to have good careers advisors. Because I remember when I was at school, I didn't know a huge amount about working in the NHS. So I knew about, you could be a doctor, you could be a nurse, but I didn't really know about other careers like management, and I didn't really know about like the commissioning side of things. So I think there needs to be more work that's done in sixth form, particularly for students to be able to understand that, because if people have the information from a young age, they're more likely to design their career around what they know. There's also things like the NHS Graduate Management Programme, which is an amazing scheme, and I know lots of people who have joined the NHS through that and, given really, really positive feedback. So programs like that, I think, should be promoted much more in schools and also in universities. But I'm also, and obviously the subjects you study actually will influence your career in healthcare. So lots of people, for example, have studied biology, chemistry, physics, maths, but that doesn't have to be the only route. So for example, I studied biology at AS level, but I also studied business, I also studied politics, and I also studied history. And English literature, actually. So a big part, I think, of being successful in healthcare is not just having an understanding of the science, but it's having an understanding of things like the funding. So how do we fund new products? How do we fund treatments? How do we fund research? And then how do we manage that? So how do we manage the business side of it and the rollout into the NHS? So having a broad educational background is actually really important. The other thing I would say is I'm a huge advocate of apprenticeships and other routes into education. So I spent about 4 years doing mentoring in schools, and that was a combination of wellbeing mentoring, careers mentoring. And some young people were really academic and knew what they wanted to do, and others really struggled because the academic route wasn't necessarily for them. And what I would love to see is some more vocational opportunities for young people to be able to get into healthcare. And even if that means young people, leaving school at 16 and then coming in through other routes, I think there definitely needs to be a lot more thinking and activity around how we do that.
Yeah, I totally agree. And that's something that we're working on hard at the National Horizon Centre.
Amazing.
Yeah, so I guess one last question for you, which is, what do you think are the next big things for the UK in the healthcare innovation space?
Mm-hmm. So there's a huge amount of activity happening around digital health. And this accelerated during COVID because of the amount of services that had to transition to e-healthcare. One of the areas where I see continued acceleration is artificial intelligence, or AI, in health and social care. So that's another one of the programs I work on at the moment as well, actually. And NHS England and the National Institute of Healthcare Research currently, for example, have a £140 million grant programme for funding health and social care applications which have an AI element within that. So I think that will continue to accelerate, and whether that's applications that are used in the home, because I think we'll see more of that, such as like monitoring your own healthcare and adherence to medication in the home. I think we'll definitely see an acceleration of that, but also devices which use AI within hospital settings. I think we will see an increase in that as well. And I think definitely one of the things that came to light in COVID was inequalities. And I think that's from many aspects, from ethnicity, from gender, from people in high clinical risk groups. And so I think we will see a continued emphasis on how we reduce inequalities in healthcare. And I'm certainly, starting to see that already in research. but I would hope that we start to see that in other areas of healthcare as well.
Brilliant. Well, it all sounds very, very exciting. So thank you so much for joining us today. It's been fascinating hearing all about your career to date and the various things you're involved in at the moment, and we look forward to working with you in the near future.
Thank you. It's been wonderful talking to you, Jen.
Cheers.